When you want to know what's wrong with you, when you're sick, you go to the doctor, right? And what's terrifying right now, though, is that RFK Jr. at the helm of things like Health and Human Services is creating this minefield of just uncertainty and worry and tension in the medical profession, and his termination of the head of the CDC and his defunding and his advocacy for insanity concerning vaccines. I mean, it's creating so much stress. For me, for others, for those of us that are sane and competent, and we just want to have real medical professionals telling us what's going on. So I invited Dr. Vin Gupta, my dear friend, and also my colleague now through the Meidas Network. Dr. Gupta, I wanted him to come. I wanted him to answer questions about what's happening at the CDC, about the defunding of pediatric brain cancer research, and just kind of the bigger picture about why what's happening now is going to have a ripple effect for decades to come. And so here's Dr. Vin Gupta. And joining me now to make all of us smarter, we were actually just joking before we commenced this interview that my mom always wants me to be Dr. Vin Gupta. So I have Dr. Vin Gupta here to make us all smarter. But all kidding aside, thank you so much always for the privilege every time. It's good to see you.
Great to be back with you, Katie.
So, Dr. Gupta, let's start with the latest. An incredibly damning guest essay was submitted to the New York Times from a huge number of prior directors or acting directors under several Republican and Democratic administrations of the CDC, the Centers for Disease Control and Prevention. And when I tell you, Dr. Gupta, my jaw dropped to the floor, it did. It wasn't so much the words that were used, it's the idea that a group of doctors that ran this specific organization agency felt so compelled to speak out publicly in this way scared me, to be very honest with you. Your thoughts about this op-ed?
I know a few of the co-authors really well and have the chance to work with a few of them closely, actually, just in sort of my non-clinical roles. And, these are not political operatives, even if they have an R or D behind their government service. They are about as down the middle as you'll get. And, I think all of them, basically, the reason they're all signatories to this letter that you referenced in the New York Times, for listeners out there, if they just go and look at Sunday New York Times on Labor Day, their op-ed section, they'll find this piece. It's an extraordinary piece, Katie, because it talks about the fact that there's always ideology anytime you have a new president. But for specifically the FDA and the CDC, NIH, or federal health agencies, there was always a clear line that never got crossed between science and ideology. And that's changed. And it's the reason, I had a chance to talk to Dimitri Daskalakis, the physician that headed the National Center for Immunizations and Respiratory Diseases, we chatted yesterday. And, this was he headed an institution that was arguably the most important institution, when it comes to developing or implementing vaccine guidance for the country. And, somebody like him who's worked on Democratic and Republican administrations says that he's never seen anything like what he's seen before. And he's worried about where we're headed, which is not just COVID, but a fundamental reevaluation of the whole vaccine schedule for children. And so now we're at a point where, the American Academy of Pediatrics is issuing their own guidance. And this is not good. This is just not good for anybody, that they are not lockstep with HHS and that HHS is not lockstep with the AAP. It doesn't help anybody.
I mean, this guest essay, and I'll note that it goes as far back as a doctor who served as the director of the CDC from 1977 to Dr. Cohen, Mandy Cohen, who served as the director of the CDC from 2023 to 2025. It makes it very clear that by the title, reran the CDC, Kennedy, as an RFK Jr., is endangering every American's health. And putting aside, I think, Dr. Gupta, whether you are on the side of RFK Jr. when it comes to vaccines or not, something that was noted in here, I think, should resonate regardless of your party affiliation, right? It says here, Residents of rural communities and people with disabilities will have even more limited access to healthcare. Families with low incomes who rely most heavily on community health clinics and support from state and local health departments will have fewer resources available to them. Children risk losing access to life-saving vaccines because of the cost. I mean, this is all happening so damn fast. And that, I think, is part of what scares me the most, that one man is now single-handedly dismantling decades of research, progress, and protection that was provided to the American people.
Yeah, I mean, the article beautifully laid it out. You just did a great job of articulating it back. And I think that's the problem, is a lot of things are happening. It's happening so fast. And the questions that I get when I'm doing a segment on what might, for Meidas or for, public media is, what does this mean for the American people and for the general public? And most often, unless you're immersed in it, like the 9 former CDC directors or those sort of right on the fringes, you aren't paying attention because you have enough things to worry about. And as a result, for example, the FDA revisiting of the COVID vaccine label, how many people are paying attention to that outside of sort of those in health media or in just broader media? Probably not a lot. But I'll tell you, we just actually did this segment for Meidas Health with the president of the American Academy of Pediatrics. And what we kept coming back to is that that FDA indication change is actually impacting, Katie, the ability of pharmacists at CVS and Walgreens, name the retail pharmacy across the country, to do their job. They can no longer. Now in 16 states, the New York Times on Friday reported that CVS was actually saying that they're going to pause COVID vaccinations in 16 states because of this kerfuffle. I mean, that is, and I suspect most people that saw the FDA headline did not realize, gosh, this is going to impact what my pharmacist is going to do down the street. So it's really that through line of, hey, they might be doing something. You might roll your eyes at it, or you may think this doesn't impact you. But here are the many ways in which it actually is, whether it's Medicaid, whether it's the FDA redetermination, NIH funding, you and I talk about a lot. It's having a direct line impacting every family, but that message has to come across as clearly as possible.
And what's amazing to me is, what it says here is that RFK, when he administered the oath of office to Dr. Meidas on July 31st, called her a, quote, public health expert with unimpeachable scientific credentials. But when Dr. Meidas refused weeks later to rubber stamp his dangerous and unfounded vaccine recommendations or heed his demand to fire senior CDC staff members, he decided she was expendable. And so he terminated her. I mean, when in the time that you've been a physician and even prior, have you seen the politicization of medicine, of science? Because I concur that ideologies abound, but when we talk about science and medicine, though, Dr. Gupta, it's supposed to be kind of sacrosanct, isn't it? Isn't it supposed to be a very kind of sacred place where we don't inject politics?
Well, yes, 100%. And I think what you're seeing play out with Dr. Meidas is emblematic of this administration, which is typically for the 9 former CDC directors, it's been about credentials. And what did he do? What was your training like? How'd you do? And the things that we want, and this is the deep irony here, is that on one level, I would suspect most American families, if they needed to get surgery, or if your loved one needed to get surgery, you're going to want the institutions of medicine to really do their thing. That you're going to want a surgeon that knows what they're doing, has appropriate educational credentials, and can show their stuff in the operating room. So that's when you want the institution to work. It's interesting, though, because now we're saying, well, we only want the institution to work. This is what RFK is saying in certain circumstances. And one day it's his friend, the next day it's his enemy. What is it? Which is it? We can't have both ways. And that's where I think there's going to be a time horizon where he's benefiting, because all the impact, the consequences of what he's doing right now, in some cases will be felt in the next few months, but in many cases we'll see devastating impacts on the course of months to years. Funding decisions, rural health issues. This stuff doesn't happen overnight. And that's going to be the issue here, is he's playing to short-term politics. He's creating a narrative arc that his social media followers like, because it's easy to tell that story and he's really good at marketing. What he's not where I think he's going to struggle is justifying these decisions over the course of, say, 3 to 5 to 10 years, but he's no longer going to be power to be held accountable. I think that's the challenge here. But there is this wanting to embrace institutions when it's convenient, and when it benefits him and his policies, he chooses to do away with it.
The guest essay calls on Congress to exercise its oversight authority over HHS, talks to state and local governments to plead with them to fill funding gaps, asking philanthropy and the private sectors to step up for their community investments. And then this is the one that really stuck with me, especially because you and I were having this conversation. Medical groups must continue to stand up for science and truth, and physicians must continue to support their patients with sound guidance and empathy. I mean, it must be an incredibly challenging environment for those that work at the CDC, the NIH. I mean, those that are left to work at these agencies, right? And these departments, that they, like, for example, the line prosecutors, perhaps, that still remain at the Department of Justice, that are still employed there. They don't ascribe to what is being imposed by this administration. It must be incredibly challenging, though, as a physician, because your oath is not to anyone else, but to the patient. In the truest sense of the Hippocratic Oath, you don't owe loyalty to anybody but the patient and to the professional guidelines and standards that you have agreed and have guaranteed to deliver. So how does it work, though, if Congress continues to present itself as being impotent, as we've seen it time and time again do, where it's just ceding ground to this administration in so many different ways? But when it comes to this, when it comes to your health and medicine, why are we not seeing Congress do more? And what can you and me and others do to call upon Congress to do more in this instance?
Well, I think you and I, and I'll say sort of media efforts for good, which you're sort of at the top of that list for me, Katie, and just all the amazing work that you do. It's continuing to do it, and because I do think public persuasion matters, and drawing attention matters, and it does change minds, even if we don't necessarily feel that sort of hour to hour, day to day. It is making a difference. So continuing to do that, especially for those that have platforms, is vital. And platforming real experts, which is, I know you do that. I try to do that my own way.
Real people, real experts,
real experts. But you call on something that's really important. And again, this is where it's making real the impacts of what folks are doing in a corner office in Washington, D.C., which is, everything that's happening right now is actually impacting how providers, medical providers, might be thinking about vaccinating somebody, quote unquote, off label. So if somebody comes in, they're 20, otherwise healthy, but for whatever reason, very legitimate reasons, say they have a loved one that's sick at home and they want to get vaccinated against COVID, they actually would need a prescription from a doctor potentially. This is what's happening. They know what they're doing when it comes to limiting access. So that patient will need a prescription. And Kennedy and his team have signaled that providers should not prescribe vaccines off label because they're opening themselves up to potential litigation, which is nefarious and chilling to think that yet another way there'll be distance between patient and provider is this yet another threat of lawsuit. But it's chilling. And so when you think about what Congress can and cannot do, Bill Cassidy, for example, highly influential, a physician, believes in the hepatitis B vaccine, which, by the way, we think is going to be next in that sort of chopping block of vaccines. For your listeners out there, if you Google Senator Rand Paul, Bill Cassidy, Twitter, you'll actually see, not to be an advertisement for X Twitter, but they had a really chilling exchange about the hepatitis B vaccine. Rand Paul basically suggesting that we should remove it from the childhood vaccine schedule, Cassidy defending it. But what's going through his mind? And at what point is enough from his perspective, much less from the president's perspective? I can't imagine any of these things that are happening right now ultimately will be to the benefit of the president, and but much less Cassidy. And so public persuasion, but also making it clear the impacts of what they're doing and how it's going to challenge providers, pharmacists, and patients across the country. I still think, Katie, there's a lot of confusion there.
So before we move on, what's the secret sauce then. So I have a 10-year-old daughter who thankfully has a sane, competent pediatrician. But, and I would like to think that I go to sane, competent providers. But your point is well taken, which is the chilling effect that it's going to have on practitioners is critically important for us to talk about, right? So what can people do in light of the very quickly moving guidance, right? And guidelines, because to your point, just less than, 36, 48 hours ago, now there's all this confusion abound about whether or not I, as a healthy 50-year-old woman, could go get the next COVID booster. Can I, can't I? I mean, do we still continue to have these dialogues with our GP, our general practitioners, our primary care physicians? What's the deal?
So, scaled information, I think, is important that people can trust. And so I'll give a few different responses to that. One, if you're just looking for something easy, quick, and navigable on a smartphone, on demand, healthychildren.org. It's a user-friendly digital platform, on the internet, produced by the American Academy of Pediatrics. Basic questions about what you should do for the childhood vaccine schedule, whether it's COVID, flu, RSV, or tetanus, diphtheria, you name it, it's all there. I highly recommend people go to that if they want something on demand. Immunize.org. Again, nonprofit. There's no conflicts of interest here. This is produced by a nonprofit that does something similar for adults. So that's scaled information digitally that I would go to before I went to the CDC website, as an example. I don't.
Outrageous.
I always think it's smart to go and have. I mean, anybody you ask will say that I find credible will say the best conversation is with your child's pediatrician or with your own medical provider. I still think that's true, although I will say this. My wife's a pediatrician. I'm a pulmonologist. There's still some stuff, and I track the policy changes quite closely. There's a lot out there that is confusing to providers because the answer is we don't totally know. And so I would say give grace to your providers if they don't know the question about whether they need a prescription or whether your insurance system will or will not cover something off label, because the answer is we sort of don't know. And this is unprecedented terrain. Payers, i.e. insurance companies, this is the first time they might be confronted with somebody who is following the AAP, American Academy of Pediatrics guidelines, choosing to get vaccinated for something, submitting that then for a reimbursement claim, and then providers saying, well, this doesn't meet the FDA guidance. Will we or will we not pay for it? No one knows how this is going to pay out. I will say there's a lot of soft influence happening, a lot of persuasion efforts happening to tell providers you must cover and must not have any changes when it comes to cost sharing, meaning you don't charge patients anything more for seasonal flu and COVID than you have previously, just because there's churn at the top. And so there's a lot of pressure being put on a lot of these entities not to change a darn thing. But give grace to your providers, for all your listeners, because if they don't know the answer, it's not because they're missing some sort of key competency. It's that this is all happening as we speak.
You actually just this is why I speak with you. Honestly, Dr. Gupta, you just brought up a factor that hadn't even crossed my mind, which is the attendant costs. I mean, literally the attendant costs if you have to go out of network or if you have to do something that's not covered. It is always a challenge to navigate insurance to begin with, but everything is so expensive when it comes to premiums, et cetera, your deductible, your copays, this idea that something like the fact that you just mentioned the seasonal flu shot just blows my mind. I mean, these are things that I guess I'm ashamed to say, I guess we were just taking for granted all this time, but maybe it was because it was founded in, again, science, medicine, facts, evidence, things that were supposed to be unadulterated, but now have, people like RFK Jr. who spent the night at a Holiday Inn and suddenly thinks that he can run massive federal agencies. Let's move on.
Yeah.
Oh, unless you want to, I'm sorry.
Just for your listeners, last flu season, almost the same number of children died from severe flu, as did during the 2009 H1N1 pandemic, you may remember.
Yeah.
And 90% of those kids, Katie, were unvaccinated. And so we were saying flu has unpredictable but devastating consequences that are not trivial. It's highly unpredictable and disproportionately, and we're talking about kids, 90% of those kids were unvaccinated. And so I think what's happening here is we know that when you diminish or when you increase misinformation on, say, the COVID vaccine, it has a deleterious impact on the uptake of the flu vaccine. And we saw that all throughout the pandemic. And I worry something similar is going to happen here, and needlessly people will die, which is exactly what you're hearing from these former CDC directors.
Which we've already seen with this ridiculous historical measles outbreak, which, that is the legacy of RFK Jr. wholesale. Quickly, Dr. Gupta, I went on what I thought was a legitimate rampage this weekend about the Pediatric Brain Tumor Consortium, an association of 16 academic centers and children's hospitals dedicating themselves to trials of novel treatments for pediatric brain cancer, basically telling its members, you have to stop enrolling patients because it's been informed that they would not be eligible to apply for funding beyond March of 2026. I had a lot of profanity, as I do, but I was just outraged that this is happening. And look, as we've seen, for example, when everything happened, when the FEMA funding got cut, and then there was a big, huge public backlash, there was this like taco from Trump, right, that he chickens out. But the gamesmanship and the games that are played with things like pediatric brain cancer research. I mean, we are literally unwinding years of research and progress. This article in the Times that I cited to in my Instagram reel talked about these novel trials that were about to launch, and now they can't. And it's just, how do we, Dr. Gupta, deal with this? Like, how do we manage this kind of onslaught of information, like what we just heard about this brain tumor consortium for children?
Well, I mean, to elaborate on that, and first of all, thank you for talking about this, because I think this is getting lost just in the flood the zone strategy that they're employing. Of the trials out there, the majority of those trials, about 80% of the trials are going to be, we fear, will be canceled prematurely, or for treatments for childhood cancers like glioblastoma. This is not a political issue. This is something that I grew up in Ohio, care for patients across the spectrum. I'm a veteran, and have seen, all sorts of people, all sorts of ideologies impacted by glioblastoma, especially children. And we're talking about treatments that we're hopeful, Katie, we were going to have in our toolkit, say 5-10 years down the road, are going to be cut short, because you can't enroll people if there isn't money to fund the research itself. And you have to have forward-looking budgets, because we know that this is going to take 5 to 10 years minimum to go from, say, an early phase 1 trial, is this safe to even experiment on humans, to, phase 4, not only is it safe, it's super effective at reducing and or treating the onset of some terrible childhood cancer. That takes time. And that takes budgets that are really baked in for years and years and years. It's what's unique about medical innovation. And it's also the investment that is required. It takes time and patience. The best way to describe what's happening right now for your listeners is, imagine a world, what do we all care about to some degree? Is we care how we look to some degree and how we present ourselves. It varies across the spectrum, but I think most people, care about how they feel, how they potentially, like just optics, and they want to look their best self. And now many people think that these weight loss drugs are going to transform society. I think there's some truth to that in a positive way. And as we're seeing, we're going to have oral versions of these come online very soon. Where am I going with this? That took 25 years, Katie, of investment from the U.S. National Institutes for Health to actually bankroll at a time in which no pharmaceutical company, no other national government said, you know what, that's worth our time and our money, because they didn't see the forest from the trees. They were not able to really see the long-term impact. That's where the National Cancer Institute, that's where the US NIH plays a singular role in the world. It takes long-term bets on big ideas that ultimately may benefit patients. We saw this with GLPs, with Wegovy, Ozempic, Zepbound, all these medications that are becoming all the rage. That wouldn't have happened. We would not have had access to these medications, Katie, were it not for the forward-looking posture of the NIH 25 years ago. Play that forward for cancer chemotherapy agents, for childhood brain cancer, for all other forms of cancer. These are now on the cutting block here. And so it's not about what happens tomorrow. This goes into the sort of the long-term horizon piece that we were talking about. This is not what happens tomorrow that we're going to feel these impacts. This is now the next 5 to 10 years, 15 years. Decisions made today are going to impact doctors' toolkits in 5 to 10 to 15 years. That's where we're really going to rue this. And that's what I fear. And I don't think necessarily this is being communicated to the masses in that way, that these decisions are going to impact everybody's family to some degree, because we're going to have less treatments in our toolkit than we did, say, here sitting and having this conversation in 2025. And let me lastly add, we need to constantly refresh our toolkits. Cancers, infections, Katie, get smarter over time. They adapt to
evolve.
Treatments that we, exactly. They evolve. So if we're not developing new antibiotics and antivirals to compete with the mutations for infections, so if we're not developing new cancer chemotherapeutic agents for pediatric brain cancer, our existing tools are not going to work in 10 to 15 years as good as they do now.
So I will say this, the one resource that you failed to mention is the one that I count on, which I think is the most important one, and that's you. Dr. Vin Gupta, you are always somebody that I trust and that I can go to for this information. Let people know who are tuning in right now how they can watch you, listen to you, follow you, because I trust you. And at a time when accessing federal websites for things like CDC, you don't even have that information on the CDC anymore, frankly. But at a time when it's important for us to get accurate, truthful information, how can people, again, watch you, follow you, and make sure that they're getting the latest?
Well, I feel the same way about you, Katie, on all things. And I thank you just for the trust. Truly, I can't tell you how much that means to me. For all your listeners, I'm most active on Blue Sky, where I share all forms of media that I do, and especially very proud of what I'm able to do for the Meidas Touch Network and Meidas Health that we're trying to build out. And really the purpose of Meidas Health, Katie, is since the nation's best healthcare leaders are no longer at the very top of the federal government, Meidas Health is trying to bring them direct to the people. And so I'm thrilled for the platform, thrilled to work with the brilliant team at Meidas Touch, to be on the same team as you, to do that. And so whether it's Meidas Health segments, whether it's other segments, whether it's just information that matters, I would say, if you follow me on Blue Sky, you can follow me under Vin Gupta MD on Blue Sky. I do my best to try to share as much information there as possible.
Great. And if they want to watch you on the Meidas Health Network, how do they check you out?
So if you go to drvingupta.com, I just launched this, and there's a podcast section on drvingupta.com. All our podcasts, we have 14 of them. Episode 15 with Dr. Dimitri Daskalakis of the CDC is coming out this week. We just had episode 14 with the president of the American Academy of Pediatrics, chock full of information that I think is useful to families across the country. You can go to drvingupta.com, and there's the podcast tab at the top, and I'll have all of our Meidas Health podcasts. Or you could search Meidas Health in Spotify or wherever you get your podcasts, and it should populate all the episodes.
Well, again, I'm grateful. I know that there is the constant having to, pay attention and stay on top of this, and you are. And for that, I am incredibly appreciative of the privilege of your time. So Dr. Vin Gupta, thank you again for making us all smarter and for being a trusted source of medical information at a time when there's so much uncertainty. I'm very, very thankful for you.
Thanks, Katie. Till next time.
Thanks. Katie Phang here. We launched the Katie Phang News Channel in partnership with the Meidas Touch Network so we could bring you the latest in legal and political news. Straight, no chaser. So if you're a fellow truth teller, hit that subscribe button and share the word about this channel so we can build a high information America together.